Dr. Tyler Williams at Pinecrest Dental. Thanks for taking a minute to watch this video. You're here because you have some questions about all-on-4 implants, or you're looking at new implant options and you're wondering how this could benefit you. It is important to know the cost because you want to know up front. You want to work with a provider that's transparent, but I'll discuss some other things you probably want to evaluate as well. So whether you're looking at all-on-4, all-on-6, all-on-5, 3-on-6, removable snap-in bridges, single implants. Maybe you're even looking at options like, should I save my teeth? Should I remove my teeth? Should I save half my teeth? And these are all good questions. The number one reason people find us is they're looking to save at least some of their teeth, but make them all look as good as implants. And there's some great new ways to do that, where you can keep most of your teeth, or maybe half your teeth, or maybe just your bottom teeth. And you can use things like veneers and Invisalign and whitening to make them look just as good as implants. But you have less cost, less time, less surgery, less healing, more comfort. Feels more natural because they're the teeth your body's used to. So this may be a good option for you. A lot of people hear implants and they think that's the one-size-fits-all, end-all, be-all. And I'm here to tell you, after meeting with thousands and thousands of patients over the years, that for most people, that's not the best option, all right? However, implants are a great option for many, many people, and it's just important to find out what your options are and not just only get, one idea or one opinion on what's best for you. With all-on-4, okay, your costs could range anywhere from $20,000 to $60,000 if you were to pay it up front. Most people who get something like that done in our office get set up on monthly payments. And so there may be some payment options too. So the three things you want to consider is, one, what are the monthly payments versus pay in full, and what's included with that, right? Make sure that the pricing and cost is transparent and upfront, so you don't get stuck with something later, or work with maybe an office who hasn't done a lot of this, and then all of a sudden they get underwater or approach something that they've never worked with before, and then you're stuck and you have to go somewhere else and start over. We've had people referred to us who had work done elsewhere or in another country where the standards weren't up to the same level, and they had to have the entire thing redone, causing sometimes tears and frustration and heartache and extra expense. The second thing you want to talk about is what happens if something goes wrong. What if the implants don't take the first time? What if something breaks? What if something comes loose? What's the protocol with the office you're working on how to approach that? Because implants are very successful, usually 90 to 95%, but there are 1 in 15, 1 in 20 that have some issues. A lot of time it's just a minor issue, all right? But if that happens, what will the office do that you're working with? And then the third one is, what will they do to make it comfortable for you, right? Comfort's a big issue. Comfort's important. What will they do to make it comfortable so that when you're getting your implants done, you can feel relaxed, you won't be anxious and nervous. Even things like gentle numbing so that your mouth and jaw aren't so sore after. What can be done in fewer visits, those kind of things. And what can be done so that you don't have to go to multiple offices where possible. Sometimes there are specialized procedures that need to be done in multiple offices, but what can be done to prevent that, if possible, to make things comfortable for you, and so you can work with fewer providers so that you know who you're working with and they know all the steps along the way. Lastly, if something comes up, how can you reach them? Who's your point of contact? What are their hours and availability? We've had people who have had some things done, then they couldn't reach the office, or people have been referred to us because they weren't available, or the office closed, or that it was a different doctor every time they were there, and they just didn't like that concept. So these are all some things to consider when you're factoring in cost, because you have to look at what's the cost if something has to be redone, replaced, because implants are not permanent, right? The only truly permanent thing is having your teeth removed. That's permanent because they won't grow back until we can figure out a way to regrow teeth. That's the only permanent option. With implants, it's like a high-performance vehicle. So there is cost, maintenance, time, visits to the office, The upkeep, you know, think about if you bought a really nice car, you'd want to make sure you got the oil change and alignment and the tires rotated frequently and periodically to make sure everything's working great. So thanks for taking a minute to watch this video. If you have some questions, please call us or email us. Our contact information is below. Be happy to answer those questions for you. We also have a copy of a book that's a consumer's guide that may be helpful in your journey in all-on-4 implants or weighing it versus removable implants and those type of things. So thanks for watching, and we will see you on the next one. Have a wonderful day.